Hello and welcome to this presentation on global health and nursing. I'm Roger Watson from the University of Hull in the UK. Thank you very much for inviting me to give this presentation at your annual conference. It's a pity that I can't be with you, but this is due to the ongoing restrictions due to the coronavirus. And it's a pity I couldn't be with you because I really like Guangzhou, but I hope in the years ahead, or maybe even the months ahead, that I can be there with you. So once again, thank you very much. Well, normally this is how I would get to China. But what I wanted to do was show you where my country is, just in case you didn't know. And you'll notice that compared with yours, it's very small indeed. And I'm about 6,000 miles away, roughly, from you. So in this session, I'm going to talk about global health and nursing, and I'm going to cover this under three things. First of all, I'm going to give you a definition of global nursing. Then I'm going to refer you to the GAPFON report, the Global Advisory Panel on the Future of Nursing, of which I was a founder member and which dealt with global nursing, and nearly all the material here comes from that. And I've sent the report to the conference organizer so that it can be distributed to you. And then I'm just going to pick up briefly towards the end on some specific issues related to global nursing. So according to GAPFON, as I say, the Global Advisory Panel on the Future of Nursing, global nursing has a long definition, but the main points are that global nursing is there to promote sustainable planetary health and equity for all people. It's not just about individual health or even community health, but it takes a wider view of health than just the health of individuals. Of course, the health of individuals is very important and key to global health, but it's wider than that. And global health, at least global nursing, involves individuals and population level care. It covers everything that we do, including research, education, leadership, advocacy, and particularly policy. And I'm going to emphasize later in this talk how, as nurses, we should be involved in formulating healthcare policy. Often we're not, and we do need to be. We do need to have what's called a seat at that high table. And finally, global nursing is about working in partnership with communities and, of course, with other healthcare providers. No healthcare providers work in isolation, and certainly nurses don't. We work in collaboration with our medical colleagues, with allied health professions, and with scientists, engineers, and all sorts of other healthcare providers. So we need to be aware of that. We need to find our place within that. And of course, most importantly, we need to contribute towards that. So this is the cover of the GAPFON report. I'm afraid that it's only available in English. It's not been translated into Chinese, for example. But GAPFON took place between 2014 and 2017, and it was an initiative of Sigma Theta Tau, or the Honor Society of Nursing in the United States. The Honor Society of Nursing is international. It doesn't operate in China because it's run from outside of China, but I know that many Chinese colleagues are aware of it, and Chinese colleagues who have worked out of China have often joined and made a contribution towards the Honour Society of Nursing. It's now simply known as Sigma. It's been rebranded. And the initiative was as it were the brainchild of Hester Klopp, who was then the world president of Sigma Theta Tau. And I was invited to be on the inaugural panel, and I attended the first meeting in Switzerland and the second meeting in Puerto Rico, and then the membership was changed slightly after that to bring in different expertise. And I left at that point, although I was involved in the launch of the GAPFON report in Ireland at the Sigma Theta Tau Research Conference in 2017. So there are going to be a great many quotes here for which I apologise, but they clearly convey what GAPFON was about, and then they clearly convey later on what it was that we found and what we established with the help of the participating countries and regions. The study was completely international, what we established as being the priorities for nursing and for global nursing across the world. So this was the GAPFON process. It began, I'll just read through these bullet points and summarize them. It began by identifying expert stakeholders from nursing and midwifery from across the world. And every major continent certainly was represented right from the beginning. My own involvement with GAPFON was because, first of all, I'm a member of Sigma Theta Tau, and I was an editor of a leading nursing journal at the time, Journal of Advanced Nursing. I now edit Nurse Education and Practice, and I also was the founding chairman of the Lancet Commission on Nursing in the UK. That was many years ago. I stepped down as chair after a couple of years, and the leadership was taken over by someone else, and we're still waiting for the Lancet Commission to report. But that was the reason I was involved myself. Then they convened what was called a core panel of expert stakeholders, and we developed a plan for taking GAPFON forward, not for what we would establish as priorities, but for how we would establish those priorities, how we would approach people and how we would get people involved. Then over a period of about 18 months, there were 7 global regional meetings, and these were to identify by consensus what the priority health and professional issues were in those areas. But the major part of this was to try to derive strategies to address all of those issues. The data were analysed, they were prioritised and brought together, and we didn't try to have an overall prioritised list or an overall strategy. We present these, and I will present them later, under each of the different regions. And then we developed and disseminated a summary of the GAPFON report, and then finally the full report. And we've also had some publications and editorials as a result of the report to try and advertise it. And I should say that the GAPFON initiative is still going forward, being taken forward by Sigma Theta Tau, although the GAPFON process, the initial process, of course, is now finished. So, given the importance of global health and universal healthcare access, which is of course not available in every country of the world, nurses and midwives have long recognised as being primary advocates, and we're the key stakeholders regarding future planning for the advancement of world health. We shouldn't underestimate the place of nurses and midwives in this process. We're key to it. We're by far, in many countries, the biggest professional health organisation. In my country, the National Health Service is enormous. It's one of the third or fourth largest organisations in the world, and the largest group of employees within it by far are nurses, and that's the same for many countries. So we shouldn't underestimate our influence and our potential influence. And while many other healthcare professions, particularly the medical profession, will advocate for patients, we consider ourselves to be primarily the patient advocate. And we're often the people who are in closest and longest contact with individual patients and in communities. And in many parts of the world, particularly in the developing parts of the world, where medical care is very scarce, nurses not only do the jobs that we do as nurses in other countries, they are the primary healthcare providers, providing a very advanced level of care. So again, we must, as a profession, recognise this and mobilise it and make use of it for the good of the whole world and for the good of the health of the whole world. So, although we constitute about 50% of the healthcare workforce, as I say, it's greater in some areas than others. We're more than 50% in my country, but I think in China it may not be the case, but it differs. But roughly across the world, we're 50% of the workforce. We noticed on GAPFON in many countries that midwives and nurses' opinions were frequently not heard, and moreover, we often didn't have a unified platform from which to speak. We do have organisations like the International Council of Nurses, but that has political problems, for example, between China and what we call Taiwan. I know there are political difficulties there. And even in my own country, my own professional organisation is not part of the ICN. So we can't necessarily rely on the International Council of Nurses to be that international body, although they're very important. And Sigma Theta Tau is not necessarily universal either. But we weren't trying to promote an organisation. We were trying to promote a concept, really, that nurses really need to think in a unified way and not, as we often do, just representing individual countries or individual specialities. And that's one of the reasons that we're often not heard. And it has to be said that the medical voice is much louder and much better organised, and of course deserves to be heard, but so do we. So we hoped that GAPFON would provide a platform for nursing and midwifery to have what we call an inclusive voice worldwide, that we would include all countries and nurses in all sorts of situations, and also to be a catalyst for a global health partnership and collaborations, and to help develop and influence policy and practice. That was the main thrust of what we were trying to do, was to try and develop a process for influencing policy and practice. It's not just enough to be healthcare workers or to draw up a list of issues. We must actually try to help and drive that agenda. So what I want to talk about first of all are the regional health priorities, and these were done simply at the meetings that were held in different regions by asking people to more or less derive their own process and to convey to the conveners of these from GAPFON what those priorities were. So I must emphasize that none of this was imposed by GAPFON or imposed by Sigma or imposed by any particular country. We wanted this to grow organically and to find out from regions what they thought were their health priorities. So I'm just going to go through those regions now just to show you this, and really this is just as a matter of interest. And you'll see that there are some similarities and of course that there are also differences. So we did this by getting data from all the meetings. We weighted that to try and identify common themes and to try and find out if there was some sort of global alignment of health issues. In other words, we tried to find out if there was some way we could rank it across the world. And these are the priorities that we derived across all the regions, but I will show you the individual regions later. Again, this wasn't a model to try and impose it on all the regions. This was really just to find out internationally if there was some consensus on the priorities. And at the top we see non-communicable diseases, including chronic diseases, and the primary diseases here are things like cancer and type 2 diabetes, and of course diseases associated with aging in populations that are well developed where people are aging. And Alzheimer's disease, for example, would be another of these diseases which is growing worldwide and which I myself have a particular interest. Second, internationally, mental health problems came up, and as well as being a primary problem, also secondary to things like substance abuse, in other words, drug abuse, alcohol abuse, and also to violence, both domestic and, of course, to military violence and coups and the things that happen politically across the world. So that was identified as a major problem. Just as a matter of interest, I imagine that mental health problems would be still very highly prioritized, particularly after the coronavirus pandemic, when people being locked down and confined, unable to work, unable to go to school, has caused a great many mental health problems. Then third were the communicable diseases, which is not such an issue perhaps in developed countries, but still a big issue in some developing countries, except of course again at the moment we've seen that communicable diseases or a communicable disease, coronavirus, has caused a huge international issue. So it would be interesting to find out now if this was still the third priority. I imagine it might move up a bit. But generally speaking, communicable diseases are not such an issue as non-communicable diseases. Then disaster preparedness and response. This is particularly important in some parts of the world, particularly Southeast Asia, the Far East, and some parts of the Middle East. Again, not such a problem in Europe, and not such a problem in most of the United States, but certainly a big issue in some countries. And then maternal and child health. Some parts of the world, the maternal mortality is very high, and of course children often don't live for very long. Life expectancy is low, so that's a problem as well. So those were the international problems, but this was really just as a matter of interest. It's far more important for us to know in different regions what the priorities are so that they can be addressed in those regions. And before I move on to the regions, other areas were prioritized or at least were given as areas of concern: healthy aging and care of older people, health equity or inequality and poverty, migrants and refugees. This is an enormous problem in my part of the world, in Europe, refugees coming from the Middle East. HIV and AIDS is still a major problem internationally, and I know there's a great deal of focus now on this in China. Tuberculosis, almost eradicated at one point, but it's beginning to grow again, and it's particularly prominent in my own country amongst immigrant communities, partly because of poverty, partly because of poor healthcare where they come from, partly because of living conditions. Emerging infections, well, this referred, of course, to SARS and MERS, but of course the emerging infections would now include COVID-19. And due to the widespread success of developing antibiotics and their widespread and often inappropriate use, of course we're seeing antimicrobial resistance, and this is a real problem internationally. And nurses are not primarily responsible for developing antimicrobials and antibiotics, but we are responsible in many cases for their prescription and certainly for their administration. So we need to be aware and play our part there. So next, the priorities in the various regions. So in the Southeast Asian Pacific Rim region, which of course includes China, and this is not in any particular priority, these are just the orders in which we presented them. We found that non-communicable diseases were the most important issue here, followed by chronic diseases, aging, maternal health, mental health, then communicable diseases and disaster preparedness. These were the issues, and that's in order of priority. Of course, the priorities are quite close together. We're not saying that disaster preparedness shouldn't be paid any attention to because it's low down. It's one of the priorities that needs to be addressed in this region. The Caribbean region, just off the coast of the east coast of the United States, was treated as one particular area, and here mental health and substance abuse was top of the list. And again, this is to do with drug use in that society, perhaps to do with poverty, misuse of alcohol, and mental health problems arising perhaps from domestic situations. But you can see that the priorities in this region are very different, for example, from your region. Then non-communicable diseases, maternal child health, some very poor healthcare in this region, which is very small, but in some cases very underserved. Disaster preparedness and response, because this is an area where hurricanes hit. You call them typhoons in your part of the world, but this is where hurricanes hit. And aging. Now, aging is important there, but lower down the list, because aging is not such an issue here as it is in some more developed and more prosperous parts of the world. Latin and Central America, communicable diseases, non-communicable diseases, were top of the priorities, followed by maternal and child health, followed by communicable diseases, disaster preparedness again, earthquakes, hurricanes, that sort of thing, mental health, substance abuse, and aging. So you can see a great many similarities here across the regions, but slightly different priorities. North America was so big and so many nurses here that this was divided into two areas, Group 1 and Group 2. They weren't particularly geographically based, but they did come up with some different priorities, but you can see some similarities between them. Diseases generally for Group 1, mental health, poverty, maternal child health. Group 2, health, equity and poverty, mental health, non-communicable diseases and disaster preparedness. So those are the priorities that should be taken together, but they were derived differently by two groups. The precise methodology can be seen in the report. And the Middle East region, disaster preparedness and response. There's a great many problems with natural disasters here. Non-communicable diseases, communicable, and then mental health. Not such a problem with, for example, substance abuse here, because alcohol is largely either banned or it's very unavailable, and they have very tight controls over the use of substances like illegal drugs, although it's not unknown it's not such a priority there. And it's interesting that non-communicable diseases take precedence over communicable diseases. And again, that is a side effect in these parts of the world of economic prosperity and development, leading to a change in diet. And type 2 diabetes and the consequences of that are an enormous problem in the Middle East. And I know that because I've been there and worked there often. Europe, our big problem, again, due to economic development and changes of diet and poor diet and lack of exercise, are non-communicable diseases. Then mental health, aging is a big problem for our society. It's a success, but it also comes with issues related to it, because these tend to be very economically developed countries where people have long lifespans. Maternal child health, migrant refugee healthcare issues, not surprising to see that there, because that's a big issue across the whole of Europe. And down at the very bottom, communicable diseases. Although again, I think communicable diseases, if we asked today, might move up due to the pandemic. I think this is the final region, African region. Notice top there, maternal child health. This is an enormous problem across Africa. The other ones, communicable, non-communicable, and mental health, probably to be expected, but maternal child health is the real issue here. A real need for midwives and community nurses and proper child care and vaccinations and all the things that contribute to child health, and also safe maternity care so that mothers can deliver safely, that we can overcome some of the taboos around sexual health and maternal health and child rearing, and provide safe maternal health and indeed safe giving birth to mothers in this region. So you can see the priorities differ. Next, and I have to say, despite the importance of health problems and of course the need for those to be addressed, what we were really more concerned about was the way in which these could be addressed and what the professional priorities were. And again, these are taken by region, and the methodology is explained in the report. So this is a different set of priorities, and I'm not going to be able to go through all of these in detail. We simply don't have time, and I'll just show you what the key professional priorities were. So this time we're starting, for some reason, with the Caribbean region, and again, you're going to see a lot of similarity in the priorities in the regions. And you'll notice that each of these are presented very differently. We allowed these regions to present these priorities in the way they wanted to present them. But leadership is a major issue in this region. Workforce, work environment and practice, policy, particularly around research. I think research, particularly in nursing, might be not so well developed here. I know that there aren't a great many academic centres in the Caribbean, and education and development of the curriculum. So those were the priorities there. In Latin and Central America, you'll notice a theme developing already. Leadership is at the top of their priority list. Policy, these were tied as being the most important too, so unusual. Then education, and then workforce and work environment and practice. So you can see that already there are a great many similarities coming up. And leadership, which of course is what Sigma Theta Tau and the members of GAPFON really tend to be really concerned with, certainly came up as a key issue. And you can see that we present it slightly differently here. North American Group 1 and Group 2 simply split up on the basis of size, but leadership at the centre, global health leadership, but also leadership generally for Group 1, leadership right in the middle, research, policy, education. And for the Group 1 workforce, wasn't such an issue in Group 2, but you can see that, again, the key thing here is the identification that leadership is a priority, implying that we don't recognize, we don't think we have the appropriate leadership to make this contribution to global health. Middle East they followed suit and presented it in a similar diagram. No surprises here. Leadership right at the center, and leadership regarding all of the aspects we've seen before, including the workforce, policy, practice, and education. Europe again followed suit, exactly the same. Leadership was the main issue, and workforce, policy, regulation, practice, education, all around that hub of leadership, and around the outside of your quality of care. Everybody had a different sort of overarching framework to put it in. For the previous one, I'll flick back to the previous slide. Can't do it, sorry. The previous slide had evidence-based practice as the overarching framework, but I think it's important to note that it's the central theme of leadership that's coming up time and again here. Africa presented again slightly differently, but at the top, guess what? Leadership, then policy, education, and workforce, and the sort of foundations for that are slightly different. These are unique to Africa. It didn't come up in other areas. One was the image of nursing and professionalism, and the other was capacity building. So the image of nursing is an issue in many countries, but I think it's an issue here because it's seen as perhaps being a low status job, and indeed a poorly paid job, and many nurses from Africa, in fact, migrate to the United States and to the United Kingdom to work there for better salaries. And also capacity building, simply having enough nurses to do the job. This is an issue even in developed countries, but it's a huge issue in countries that tend to be economically less developed and in fact to be quite poor. So slightly different pattern of priorities there. However, leadership was a key issue. So we drew up, based on the collected priorities from the different regions, what we call the GAPFON model, and that's it there essentially. We try to use all these priorities, and we did try to have a sort of an overarching framework for the different parts of the world, simply because there were so many similarities. We felt it was possible to do this, and it was quite clear that at the middle of this, without any prompting from us, that leadership was the key issue, and that the issues that had to be addressed around that, the most important issues, were policy at the top and the regulation of the profession, and who gets into the profession, who is described as a nurse, and how we can make sure that they practice safely and indeed can be removed from the profession if they are not practicing safely. That's very regulated in my country, and I imagine and I know it is regulated in China. It's not the case in other countries. Workforce is an issue, the development of workforce, getting the right balance between professional and educated and qualified nurses, how many of them you need, what kind you need, and of course issues related to practice that come out of that, and particularly, for example, what is the scope of practice? What can nurses do? And this is widening all the time. I know in some parts of China, because I've spoken to colleagues there, that you are looking at more advanced practice and, for example, allowing nurses to prescribe medications. That's very common in the United States and now very common in my own country, but not so common in other parts of the world. And of course, underpinning that, the education of nurses, the type of education, the level of education, and the absolute need for research so that we can take responsibility for our own practice and that we can generate the knowledge base that we need to feed into our practice, and that we can have responsibility for developing our own profession. So none of these things are really more important than the other, but the sort of the glue that holds it all together is leadership, and leadership in all of these areas. So we consider that the GAPFON model provides a framework to support nursing and midwifery's contributions to both global health and to professional issues. So there's a need at both levels for development. We need to think globally and see what we can do in terms of promoting and providing global health. But of course, we need to develop ourselves professionally in order to be able to do that. So next I want to just look at some of the issues that came out of this before turning to one or two specific issues before I finish. So we developed, again, with the help of the different parts of the world, we developed a list of strategies under each of these headings. And of course, the first one to address was leadership. Now, I just want to point out to you that these lists go over several pages, and I'm not going to show you them all here because it would be too detailed, it would take too long, and it wouldn't be very interesting. However, what I want to do is just show you the first page of each of the list of priorities, and to show you the sort of top bullet points here. And so, for example, taking the top 3 bullet points under leadership, this won't happen by accident. So we considered, and there are already programs internationally. The World Health Organization runs programs to do this, for example, and the International Council of Nurses does it. But we need to cultivate and position leaders at all levels. So there's an argument about whether leadership is a natural ability or whether it's something that people can be taught. Even if it's a natural ability, and I'm not going to argue about that, but even if it is a natural ability, people need to be helped to grow. We need to identify leadership very early and then to get these people into the right positions in nursing at all levels, locally, regionally, nationally, and indeed internationally. And one thing I would say here, this is a view that I promoted when I was on GAPFON, is that we need to get away from the idea that everybody needs to go through a certain number of years of clinical experience or going through hoops and steps in order to get into leadership position. If we identify young, newly qualified nurses who are clearly going to be leaders, we need to start cultivating them right from the beginning. And we also need to be clear that we're cultivating the right kind of people. The next bullet point is not so easily done, but we need to increase the number of nurses and midwives in elected government positions. And we have some of that in the United Kingdom. For example, we have members of Parliament who are elected, and they have nursing backgrounds. But we also have nurses running, for example, medical research committees. This would have been unheard of years ago. And I know, for example, in Jordan, the former Minister of Health was a nurse, and I know that likewise in Taiwan, one of the former Ministers of Health was a nurse. So it can be done, but we need to do more of this. And there are certainly some parts of the world where it would be unheard of to have nurses in these positions, but we need to fight for this, and we need to work for this. And again, the third bullet point, leading coalitions to address equity and health issues. Nurses should be leading coalitions of other health professionals. We shouldn't always be secondary. There are clearly times when medical colleagues and other colleagues need to lead things, but there are also times when nurses could take the initiative and lead. And of course, the fourth bullet point, of course, we need to develop and mentor the next generation of leaders. It won't happen by accident. So I'm not going to go into all of the bullet points even on that slide, because again it would take too long, but those are the main points under leadership. I'm going to look at the rest of the global strategic priorities in order now. In terms of policy and regulation, the most important thing here is that we take part in influencing health policy and the global health agenda. We don't stand back. We seek to get ourselves elected or involved in these committees. And we have an evidence-based policy agenda. We've got evidence-based practice, but we don't seem to have developed an evidence-based policy agenda. And I don't think we have yet, but we do need to develop evidence to show that policies are working. The problem with policies, particularly in a country like mine, is that governments change frequently, as does policy, and we rarely have the time to see if policy is working. But that shouldn't be an excuse for not doing research and finding the evidence for which policies work best. And we do need to have a nursing and midwifery voice that's united. We are different professions, nursing and midwifery, certainly in my country, but we've got so much in common that we do need to have a united voice. And that's particularly important for midwifery because it's a much smaller profession. And again, the fourth bullet point is a little bit like the previous one for leadership. We need to promote nurses into decision-making positions, for example, in non-governmental organisations and other appropriate organisations. The voice of nursing should be heard at all these levels. Next, on workforce. Here, the most important thing is that we need to advance what's called a systems approach to human resources for health. Too often, human resources policies deal just with nursing and just with particular sections of the workforce. They don't think about them all together in a sort of united way. And this is particularly the case again in my own country, where we go from crisis, from not having enough nurses, then to having perhaps very briefly and very rarely too many, and we have to do something about that. And we don't seem to take a proper long-term and systems-based approach to this. Now, I'm not an expert on systems-based approaches to human resources. Other people are, but it's by far considered to be by far the most effective way to look at human resources. In other words, to consider nursing within the place of other professions in health. And we need to strengthen the workforce. We need to promote what's called capacity building and quality nursing and midwifery practice. So we need to invest in developing people within the nursing profession. We can't just leave them. The fourth and fifth points are really, I think, very interesting ones, and I was glad to see them so highly prioritised. We need to develop retention strategies for nurses and midwives. I don't know, and I don't think this is such an issue in China, but I may be wrong. It's a huge issue in my country. We're losing about 25% of nurses, something like that, within the first year after qualifying. We're losing nursing students up to something like 50% during their education. And we're increasingly finding that nurses are retiring earlier due to stress and due to physical incapacity. And of course, we need to be caring better for our workforce and developing strategies to keep them in the workforce. And I'm particularly interested in that because my own research is involved with retention strategies for nurses and midwives. I have to say we don't have a clear answer, but we still need to work hard to finding one. And then developing advanced practice rules. This is important. My country's got a very well developed health service, but doctors are becoming more specialized, busier, and doing far more complex interventions and operations than they used to. And healthcare is expanding, and the needs of the health service are expanding all the time. And the gap is being filled by having advanced practice rules. For example, advanced practice critical care practitioners. I have an interest here. My daughter is an advanced practice practitioner in critical care. She has her own caseload. She can discharge patients. She can prescribe her medications, and she is directly accountable to the consultant. And she's a nurse. She's not a doctor. But in some parts of the world, in the developing parts of the world, having advanced practice rules is probably the only way in which we're going to be able to address the needs in those countries, because they're never going to employ enough doctors to do it. So those are the things that need to go into the workforce. And of course, this is very closely related to the issues concerned with education. But before we get to education, again, practice, and of course the practice issues are also predicated upon good education. But basically, we need to promote, good quality nursing. We need to promote community initiatives. We need to be concerned about things beyond health, social justice, human rights, all these things that have impinge on people's health. And we also need to ensure that we're serving the patients and the public by involving them in their care. We need to ask people what it is they want, what they think the priorities are, and how they want it to be delivered. After all, they are paying for it. And other issues there, creating networks across nations, regions, and of course internationally to address these issues. These things may sound very simple or even prosaic, but there's a need for them because they actually, at the moment, don't really exist, or don't exist in adequate enough quantities, and certainly don't seem to be working well enough to provide appropriate health across the whole world. And finally, I think this is finally education. I won't go into this in too much detail. We won't have much more time left. But basically, we need to address our educational programs so that they're really innovative and transformative, all these big words, and most of all that they're interprofessional. We educate nursing students alongside other professions, or at least that they know what these other professions do. We do that in my own university by having simulated exercises involving medical students and nursing students. That's one simple way to address it. But it's absolutely crucial that the professions understand each other and don't grow up in silos. So the development of medical schools or health schools that educate both nurses and doctors and do it together as much as possible is very desirable. And also need to develop, basic education programs that are really about how to make nurses adaptable to changing healthcare needs, and that global health issues are actually part of those programs. We should be learning to educate nurses to take care of the whole world and to work anywhere in the world, not just locally in their own hospitals or even in their own countries. And it's very crucial. This is very well developed in China. I know quite well developed in the UK, but it could be better, is promoting postgraduate education at master's level and doctoral level for nurses and midwives. It's absolutely crucial so that they can have the sort of specialist education and things like policy and health economics, but also that they can become educated to do research. And again, we take responsibility for developing our own research base, our own professional base. If we don't, no one else will do it for us. And finally, to underpin all of that, of course, research. We need to get better at it. Research in nursing is pretty well developed, but it's still quite new and almost unheard in some parts of the world. But we do need to be documenting our care. We need to be integrating the best research into our practice. We need to be understanding evidence-based practice much better. And we also need to be strengthening the part that we can play from our own research base in having an impact on health policy and healthcare management, and not simply being passive in that. And the fourth point, I think, is very, very important and not done enough. We do need to replicate studies that we think impact nursing. We do need to carry out more replication and not depend on single studies. And this will do two things. One, it will give people a wider experience of doing that research and doing it across the world. It will also give us the ability to meta-analyze those data to see where the effects really lie. There's not enough of that within nursing research either, unlike in medical research. So it's a very integrated strategy, all based around leadership. All of these aspects, policy, practice, education, research, they all require leadership to see these things through. If you have a look at the report, you'll see the full list of bullet points there. There are a great many more, but these are the most important ones. So finally, on this section, before I finish off on some specific examples, improving global health will require collaboration among all stakeholders. Thus, organizational partners will be encouraged to incorporate other health disciplines and intersectoral partners, in other words, management, policy, economics, all the things that are not directly connected with health but impinge on health and have an influence on it. They all need to be involved to achieve these strategies. Again, it's very easy to say these things. We know they're essential, but we need to do them. And again, the way that these things will be approached is through leadership, and certainly leadership of the kind that was shown by Hester Klopp when she established GAPFON and brought so many disparate people together, all in nursing and midwifery, but disparate people from different parts of the profession, from academia, from management, and from all across the world. It can be done. It requires some vision. As I say, it requires leadership. So just to finish off for a few minutes, some specific issues in global health that we could be addressing that are common across the whole of the world and having an effect everywhere. The aging population, and this happens to be a picture from Hong Kong, from China, but the aging population is an issue everywhere now, certainly in the developing countries. So this is a major global health issue, and we need to be learning from each other about how we manage and how we care for and how we provide the correct, dignified, ethical care for older people. I think there's a particular issue in some parts of the world. I'm going to use China as an example. Here is your population in terms of the age distribution. That's 1970. Those are real figures. You can see that there was a good ratio of younger people to older people providing that care. That's not a real figure, of course. That's projected to 2050, but you can see what's predicted to happen is that the pyramid becomes more parallel, and indeed it inverts. And what's happening is we're finding more people in the older age groups than in the younger age groups, and that's causing a problem. Not only in China, by the way, but it's particularly exaggerated here. So this has got economic problems as well as healthcare problems, but it has to be addressed if we're going to provide, as I say, dignified, ethical care to older people. And I know it's a major policy initiative and issue in China, and I think that we in other countries can learn a great deal from you about how to deal with this particular issue. I don't want to dwell for too long on the poor image of nursing, but it is an issue, and it's an issue internationally. And it's a strange one because in many countries we're considered to be angels and to be excellent, good people, but still looked down upon in some ways, simply by the fact that there are a great many people who wouldn't want to be nurses. And there are some countries in which this is a particular problem, particularly in parts of South Asia, for example. However, the image of nursing is that it's a majority female population, that it's a subservient secondary profession that doesn't do research. Nurses don't need to be very well educated, poorly paid. Well, only two of those things are true. It is, for some reason, and really always has been, apart from in some parts of the Middle East, a majority female occupation. I don't really understand that any longer, although it has roots in culture and tradition. And we do, in many parts of the world, tend to be poorly paid, or certainly poorly paid compared with some of our other medical colleagues. However, I'm not going to get involved in the politics of that. I think we need to be much better at telling people what nursing can do and how important it is, and then people will take us more seriously. We can't just complain, we need to show evidence. And Linda Aiken from Pennsylvania University has led for many years an international project now called the RN Forecast, which is active in China, I believe. And this is looking at the effect of the numbers of nurses and the levels of education of nurses. And I'm going to show you a couple of graphs that Linda gave me and allowed me to show. So these are the expected deaths per thousand discharge at different staffing levels. And you can see quite clearly that the expected deaths per thousand at different staffing levels go down with the ratio of patients per nurse. So the fewer patients that nurses have to look after, the lower the death levels. It seems completely logical, doesn't it? But there aren't many figures demonstrating it, and this comes from the RN Forecast, which was a huge study and initially published in The Lancet in 2014. To me, as a nursing educationist, of even greater interest is the fact that the higher the percentage of degree nurses or Bachelor of Science nurses as opposed to nurses without degrees, the higher the percentage, the lower the death rate per thousand discharges. So again, and this has been shown in other work, and I've shown this in some of my own work as well. Some countries don't have an all-graduate profession. We have only moved towards that recently. But part of the reason we move towards that is evidence like this. So when people say things like nurses don't need degrees or don't need to be highly educated, you can say maybe not, but if we are, we provide better care and we save more lives. Preparation for disasters is another major area where we need to develop. That was shown in the GAPFON report. And strangely, within the GAPFON report, one thing that wasn't an issue was climate change, but that's clearly an issue. Both the global warming and the change in climate, and also pollution, which is causing climate change. So the environment is an issue. Now, as nurses, we maybe can't do very much about that ourselves, but we can prepare people for the events. For example, with the extreme heat that some countries now develop or experience from time to time, which is unprecedented, a great many old people die. So part of our job could be to educate older people how to cope with heat. It's always traditionally been helping older people to cope with cold, but in fact I think in my country more people die in hot spells than do now in cold spells. So we need to be aware of this, not obsessed with it, but aware of it and aware of the part that we can play. finally, that's the initial group of GAPFON with Hester Klopp in the middle. You may recognise other people around here. I'm sorry I can't remember all the names, but you'll see me up at the left-hand side there, taller than other people with white hair. But many of these people are and remain good friends and colleagues. So that was the initial meeting in Switzerland in 2014, a long time ago. Well, thank you very much for listening. That's my hour up. If you want to contact me, my email is given there. I also have Orchid if you want to check my research. You will not be able, at least legally, to follow me on Twitter, but you will be able to connect with me if you want to on WeChat, and I'm always very glad to hear from people on WeChat. So thank you very much for listening. I hope that was useful, and once again, thank you very much for the invitation.